Hey, it's Jessica DaMassa with WTF Health. I'm here at Frontiers Health, and joining me in the studio right now, I have Skye Gilbert. She is the Deputy Director for Digital Health at Path. And so, Skye, you're going to have to tell everybody what Path is, because I had no idea when you walked up, but this is actually really cool. You guys are a nonprofit with a really big mission as far as digital health and healthcare is concerned. So tell me what you guys do.
Great, thank you. So Path is a 41-year-old global health nonprofit. It was started by a couple of engineers in a garage in Seattle. The other startup in a garage.
Every garage in Seattle has like people starting something on it.
And its mission is to ensure that innovations improve health equity throughout the world. So not only reaching the wealthiest populations, but also the underserved. The digital health team within Path is about 10 years old, and similar to the parent institution, our mission is to ensure that digital innovations reach and ensure health equity.
That's really important, and I feel like, I don't know, this year I've been hearing a lot about, probably because digital health is starting to really become widely adopted, and I've been hearing more about technology becoming like a social determinant of health, where it's like access to technology or not having access to technology is really shaping people's experience and their ability to get care. So go ahead and tell me a little bit about what you guys are trying to do to make sure that that's not the case.
Yeah, so if we think about health equity in general, we've made enormous gains in the last 20 to 25 years improving health equity by improving life expectancies in countries throughout the world. And this is one of the best times, this is the best time ever to be born in terms of just, no matter where you are, having a better chance at a quality life. I think one of the challenges we see with digital is because it's improving so many lives, particularly in high-income contexts, there is a risk that all these equity gains we made will start going away. As in high-income markets, people's life expectancies continue to go up and up. Digital access and access to these digital interventions in low-income countries will not just help populations with the challenges they're encountering today, but as non-communicable diseases rise in these countries, that will also be, it'll become more and more important for them. And we're already seeing the power of digital with some of our deployments today. Even if you looked at, communicable diseases, we were able to reduce malaria deaths by 90% in the southern region of Zambia province through our Visualize No Malaria project, which was just bringing different data sets together and equipping managers with the information they needed to allocate bed nets and indoor residual spraying effectively. We've saved health workers hours per month in reporting just by digitizing their health information systems. And we've increased immunization coverage rates in Vietnam.
Wow, those are like fantastic outcomes that you're reporting already. And so I was going to ask you, so tell me a little bit about what's on your agenda as far as areas of focus for this year and also for moving forward. I mean, this is very broad what you're trying to do, but so I'm sure you've got some specifics that you're trying for.
So as we've been going across and achieving this impact in different geographies, we've wanted to accelerate access to digital for these populations. And so we have a new mechanism called Digital Square, whose purpose is to bring the right kind of financing, the right kinds of software products and solutions to these markets as quickly as possible. And it does that by basically bringing and consolidating different kinds of capital together and then doing notices or calls for investment so that software products can apply.
Okay.
And then based on a set of criteria that were determined by a global body that WHO sponsors, the Health Data Collaborative, evaluating those products and having the top ones be selected for financing and support to accelerate their scale.
Okay, so let me make sure I have that right. So it's like if I'm a startup company and I've got a digital solution, I can come in through you guys and I can actually get capital to help me deploy in one of these underserved markets. Is that right?
You can get capital, and you can also get recognition by the development community that you are a digital global good.
Okay.
So it's also a sort of badge of honor, if you will, that can help you not only through our mechanism, but if you're having conversations with others.
Okay, and I'm curious, like, do you guys also provide, I guess, like that on-the-ground support that a company might need in order to like meet the right people and help kind of deploy their solution?
Yeah, I think that's one of the most valuable things a nonprofit can provide when they're in a market that a private sector company is not in yet. Is we tend to know the markets and the ground truths really well and can foster those kinds of connections. The other thing that we've been learning, because we're relatively new, we're only a year or so old, is that sometimes we get demand from the software products and services to provide support on QA or provide support on their communications plan. And so we're still learning what kinds of services folks are looking for, but we're starting to see some patterns emerge. So we may offer more in the future.
Okay. What markets are you in? Like, I'm sure this is targeted as you're rolling out, right? So what markets are you working with for Digital Square? And then I'm also curious about what kinds of solutions you're looking for. I've got lots of startups who are out there, I'm sure, watching like, I wonder if we fit into this. So tell me a little bit about both of those things. What market are you in, and then also what solutions?
So we're predominantly in low-income countries and low-middle-income countries.
Any ones in particular?
Sub-Saharan Africa, and then also in South and Southeast Asia. The markets where we are, and then the markets that we're most deeply connected right now are Tanzania, Kenya, South Africa, Vietnam, India, Democratic Republic of Congo, and Senegal.
Okay.
However, the products that we're partnering with, they aren't restricted to those geographies, because the Digital Square also has 40 plus implementing partners that are in way more countries than PATH is. And so those partners can work with these tools as well.
Oh, very cool.
So the network is it could be continent-wide for huge. Africa, very large for South and Southeast Asia.
And then are there those areas of focus or priority in terms of like, I mean, like you'd mentioned malaria, you had mentioned vaccination, you had mentioned even digitizing records. Yeah. So I mean, are there like key focus areas that you're trying to tackle first, or is it just basically like you guys see a solution that seems like it's going to be amazing and you guys just roll it in?
We try to do a little of both, so this really depends on our investors. So if an investor comes and wants to really solve HIV, then there'll be a call potentially or a focus on HIV-related solutions.
Sure.
They don't have to be tailored because, for example, if you're looking at adherence to HIV treatment, that's also relevant to adherence to immunization schedules, adherence to other types of treatment. But basically, the investors might pick a theme, or they might just want to generally contribute. And that will drive some of what we call for in the investment calls.
With the investors that you're working with, who are these groups? Are they venture capital? Are these like big institutional investors? Who are these guys?
Right now, we have USAID and the Gates Foundation have been the biggest supporters so far. We also have a series of small family foundations that are particularly excited about another small initiative that we're starting, which is trying to build the capacity of leaders in these countries to be able to make robust procurement decisions and have really good processes around product selection. So there's some work there. We have a couple of private sector companies on our board, so including Wipro and Tableau, and we're interested in that in exploring further conversations.
Sure.
Yeah.
I was going to ask you too, I mean, how are you working with the healthcare systems in each of these countries? Because I mean, it's one thing to you don't want to fly in and drop a solution and then just leave, right?
Yeah.
I mean, it's got to be integrated in, otherwise you create a slew of other problems, not only for the patient, but also for the healthcare providers who are trying to deal with this on that end. So how are you guys working with the healthcare systems in these countries?
So I have a two-part answer.
I love two-part answers, Skye.
Within this Digital Square initiative, where we serve as secretariat, we actually don't need to work with the countries at all. Whoever the country wants to be their implementing partner, whether it's us, one of the 40 others, or they want to work direct, they can pick these digital health products and put them directly into their system. Now, in countries where at PATH we are an implementing partner of the government, so separate from Digital Square, the way our ethos is really to go in and spend a lot of time listening at all levels of the system, from the National Minister of Health all the way down to the frontline health workers and in the private sector health system as well. What are the challenges they're encountering? What are their needs? And then using that to inform what kinds of procurement guidelines they would want to have for selecting products.
Okay.
And then we assist them in thinking through the overall design of their system and how some of the digital global goods might match to the needs that they've identified.
I'm curious. I love talking to people who work abroad and have a lot of experience working. No, I do. I love it because I feel like there's a lot to learn outside of the healthcare system that you're in, whichever one you're in. You can always learn something new when you're looking at how other countries are tackling different health challenges. And so I'm curious, from the work that you're doing, what are you seeing out there? I mean, and in particular, I want to know, like, are people, from your perspective, I mean, the markets that you're working in, what is the patient reaction or the clinician reaction to, like, these digital health solutions? Are they excited to see them? Are they curious about them? Are they a little skeptical? Like, what has been the reaction?
It's a great question. So I think that the biggest difference context-wise and to keep in mind is that when we talk about the rapid growth of digital everywhere, half of Africa still doesn't own a mobile phone, and even fewer have a smartphone. And so what we see is that we need to tailor how we talk about digital and how we introduce this to context. If a facility has no power, no 2G network, and half their community doesn't have a phone, we're going to go in and have a very different set of conversations and potentially a different set of solutions than in an urban center where everyone has a smartphone and they've got 4G. But I think that what there is with digital is when people have had a chance to get to know it and interact with it, I would say that there's hope and enthusiasm and optimism when the deployment is done well, because digital has the power to save hours and hours of time. It has the power of putting information at people's fingertips, and all of that translates to, as we saw in the case of malaria or immunization in Vietnam, lives saved.
And what's been the biggest challenge? I mean, as you're rolling some of these things out, I mean, I talk to a lot of different innovators all over the world about different things that they're trying to implement into systems. Everything from EMR implementations in the U.S. to, different situations like the ones that you're talking about here. And if you were to say, I mean, like, what has been like one of the greatest challenges or the greatest roadblocks to implementing some of these digital solutions in these countries, what would you say?
I have a nerdy answer.
Oh my God, I love nerdy answers.
Information asymmetries. So
what does that mean?
What that means is in Digital Square, what we're fundamentally doing is going where the traditional market is not working and trying to match supply and demand. But what is known on the demand side about the context and about the needs is not easily communicated to supply side. And what is known on the supply side about what it takes to make a high quality software product and get it to market is not well known on the demand side. And because of that, there are plenty of opportunities for mistrust. There can be fear. The cost of brokering that partnership can be very high. And so the more we can do to share information across, and us and our matchmaker will facilitate that, I think the more we'll be able to open these markets. I think just a crack, if we just start with the crack, it will open itself up.
I really feel informational asymmetry. Is that what you just called it?
Information asymmetry.
Information asymmetry. I think that is a big problem across healthcare. So I think that you're right, and I like that label of it. It's a very a sweet label for a very big problem. Thank you so much, Skye, for joining us and for talking a little bit about your work. If people want to find out more about Digital Square, about Path, where do they go?
They go to digitalsquare.org or they go to path.org.
All right, very cool. Yeah. Thank you so much for joining us. It's a pleasure to have you. I'm Jessica DaMassa with WTF Health here at Frontiers.